Good morning, everyone. My PhD topic is Complementary and Alternative Chinese Medicine in Pediatric Oncology. Since I joined the program later than the others, I wasn't at the same pace as the others. My name is Ximeng Li, and I studied the biological science at a traditional Chinese medicine university in China, and gained 2 years of laboratory work experience. During my studies, I became aware of the limitations in translating the basic research findings into the clinical applications. It was then that I discovered the CTM program, and which I believe plays a vital role in bridging the gap between the basic research and clinical practice. Motivated to contribute to this important field, I chose to join the CTM program to make a meaningful impact in advancing clinical applications. So my vision is to improve the quality of life of pediatric oncology patients during and after treatment, and my mission is confirm the efficacy of traditional Chinese medicine and promote the use of traditional Chinese medicine complementary therapies. My topic is investigating the addition of complementary Chinese herbal medicine among pediatric oncology patients treated with Western medical therapies. It's a systematic review and meta-analysis. I'd like to introduce some traditional Chinese medicine methods at first, like acupuncture, manipulative therapy, cupping, and herbal medicine. My project will focus on herbal medicine, which are most commonly used in China. Chinese herbal medicine is a traditional practice based on the principles of traditional Chinese medicine. It uses natural substances and diagnostic techniques to create personalized formulas that promote health and treat illness. Since it is natural and personalized, it may offer a gentler and more holistic approach to pediatric health care than conventional Western medicine. The short, medium, and long-term side effects of cancer therapy in childhood is still an unresolved and eagerly investigated area. Chinese herbal medicine plays a positive role in regulating patients' immune system, which helps cancer patients to fight against cancer itself and finally improves patients' life quality. So our aim is to investigate the effect of additional Chinese herbal medicine therapies in pediatric oncology. Our clinical question is, does additional Chinese herbal medicine therapies change the effect and toxicity of Western medical therapy in pediatric oncology patients? For the population, we have pediatric oncology patients, and for the intervention, we use Western medicine with additional Chinese herbal medicine therapy. For the comparison, we have Western medical therapy, and we are looking for the outcomes like effectiveness, toxicities, and side effects. Our hypothesis is the additional Chinese herbal medicine therapy can improve survival rate and reduce the side effects and the toxicities of Western medical therapy. Our clinical implication is inclusion of Chinese herbal medicine in current guidelines. So this is my search key. I have 4 domains: pediatric, oncology, Chinese herbal medicine, and RCT. I searched both the English and the Chinese databases, and there are about 5,000 articles after the duplicate removal, and now we have 82 eligible articles. And I'd like to show an example of the effectiveness of TCM via an article published in 2016. This is a retrospective cohort study of 292 pediatric leukemia patients. All the patients received the Western medicine-based pediatric oncology treatment, and one of the group had additional traditional Chinese medicine treatment during the follow-up. I would like to highlight that, as you can see, the Kaplan-Meier curves shows clinically and statistically significant in overall survival. I would like to show another article published in 2022. This study investigated the clinical effects of combining the Chinese herbal medicine with chemotherapy in the treatment of children with acute leukemia. And the study group showed a statistical difference in the measured values of T lymphocyte subsets before and after treatment. So now I'm working on the data extraction, and the deadline is 24th of June. This project is planned to complete it by November. I'd like to close my presentation with a quote: "Keep your face always towards the sunshine, and the shadows will always fall behind you." Thank you for your attention.
What are the most common outcomes that you have found in the articles?
So, in those articles, the most common outcomes are some parameters related to immune system, like the T lymphocyte subsets is the most common one, and including the helper T cell and cytotoxic T cell.
There are many different types of traditional Chinese medicine. What is the most frequently used in Hungary?
The most commonly used TCM methods in Hungary is acupuncture. Acupuncture involves inserting the needles into the specific acupuncture point to stimulate and balance the flow of energy in the body. And Semmelweis University has invited Dr. Xingyun from Hebei Medical University in China to provide some practical training to Hungary experts, teaching them the acupuncture techniques.
I was wondering that in your finally included articles, which forms of Chinese herbal medicine was used and which was the most frequent one?
So the most frequent one is orally. About 50% of the articles, the herbal medicine is taken orally, and there are 40% of the articles they use the form of injection, and the rest of the articles there also are some the other forms like mouthwash or paste.
I have a question regarding these products. That can you list some of them that you are going to investigate in your meta-analysis?
Sorry.
So some of the products, can you list them? So what have you found and what is included in your search key, for example, that you are going to investigate?
You mean the Chinese herbal medical products? Well, actually they have their own prescription name, but they are all the Chinese, like, can I say the Chinese name? Since they don't have the official English translation. Like the most commonly used is huangqi. It's a kind of Chinese herbal, most commonly used in oncology patients.
I would like to ask for adverse events in the Chinese traditional medicine, especially in the herbal remedies, if there are any risk, for example, like drug-induced liver injury, etc. Thank you.
Sorry, can you repeat?
I would like to ask if there are any risk associated with using the herbal medicine. For example, if there is, what are the risks of, like, for example, drug-induced liver injury in the usage of traditional medicine?
You mean there are some risk of using Chinese herbal medicine? Yes, but I think it's more gentler than Western medicine, since the Chinese medicine, we based on each person, each patient, their situation, their system, and give them different prescription. It's based on their system. But for the Western medicine, they use the same medicine for the same disease. And in Chinese medicine, although you are the patients, they have the same disease, but at most of the time they use a different prescription based on their own body situation.
Based on your current data extraction, do you think that you are able to do a subgroup based on the time duration? So how many weeks they used specific Chinese medicine?
Well, actually, in different articles, the time is different, but the most common they used is in 1 week or 2 weeks.